At 35,000 feet, the captain's heart stopped beating. The co-pilot froze in terror. Passengers whispered prayers. Then a quiet woman in seat 12B stood up, her vacation ending, her true identity revealed. She had minutes to save a dying man. No hospital. No help. Just her hands and her training. Before you watch full story, comment below from which country are you watching. Don't forget to subscribe for more amazing stories. Sarah Chen pressed her temple against the cool airplane window, watching clouds drift past at 35,000 feet. Seat 12B had become her sanctuary for the next 4 hours, a temporary escape from the relentless pace of the cardiac intensive care unit where she'd spent the last 6 years of her life. The book in her lap remained unopened. She'd been too exhausted when boarding to even pretend to read, letting her mind float in that peaceful numbness that comes after 3 consecutive 12-hour shifts. Around her, Flight 447 hummed with the ordinary sounds of transcontinental travel, the murmur of quiet conversations, the occasional ding of the call button, the whoosh of recirculated air through overhead vents. She'd specifically chosen this Tuesday afternoon flight because it was half empty, giving her the luxury of an empty middle seat and the illusion of space in the cramped economy cabin. The flight attendants moved through the aisles with practiced efficiency, distributing beverages and snacks with the kind of mechanical pleasantness that comes from repeating the same motions hundreds of times. Sarah accepted a ginger ale and declined the pretzels, sipping slowly while her body gradually released the tension it had been holding for days. This was supposed to be her week off, 5 precious days to visit her sister in Denver and remember what it felt like to exist outside the fluorescent-lit corridors of the hospital. She'd deliberately left her nursing credentials at home, tucked into a drawer with her hospital badge and the stethoscope that had become an extension of her body. For 1 week, she wanted to be nobody in particular, not Sarah Chen, critical care nurse, not the person everyone turned to when codes were called and patients were crashing. Just Sarah, someone's sister, a woman who could sit in seat 12B and let someone else carry the weight of responsibility. In the cockpit, Captain Michael Rodriguez had been flying for 23 years, accumulating over 15,000 hours in the air and a reputation for smooth landings even in challenging weather. At 54, he represented the ideal of commercial aviation, experienced, competent, utterly reliable. His co-pilot, Jake Morrison, was 32, still building hours toward his own captain's position, comfortable in his role as second-in-command. They'd flown together dozens of times over the past year, developing the easy rapport that comes from shared routine and mutual respect. The flight from Boston to San Francisco was one they'd both completed countless times, a straightforward 5-hour journey across the country with nothing remarkable about the weather, the aircraft, or the passenger manifest. Captain Rodriguez had commented during pre-flight that it would be a milk run, one of those flights where everything went exactly according to procedure and nobody would remember anything about it by the time they reached the gate. The first indication that something was wrong came so subtly that Jake Morrison almost missed it. Air traffic control had requested a minor altitude adjustment to accommodate crossing traffic, a routine request that Captain Rodriguez should have acknowledged within seconds. Jake waited, expecting to hear his captain's voice confirming the instruction, but the cockpit remained silent except for the steady drone of the engines. He glanced over at the captain's seat and saw Rodriguez slumped forward slightly, his right hand hanging limply beside the yoke. For a moment, Jake's brain refused to process what he was seeing, trapped in that cognitive gap between expectation and reality. Captains don't just slump over. Experienced pilots don't go silent mid-flight. There had to be an explanation. Maybe Rodriguez had dropped something, maybe he was experiencing a moment of turbulence-induced nausea, maybe he was adjusting something Jake couldn't see. Captain. Jake's voice came out uncertain, still caught between normal procedure and creeping alarm. Captain Rodriguez? Nothing. No response, no movement, no indication that the older pilot had heard him at all. Jake reached across the center console and touched Rodriguez's shoulder, feeling the complete limpness of unconscious muscle, the terrifying absence of normal tension. The captain's head lolled slightly at the touch but didn't lift, didn't turn, didn't show any sign of awareness. Jake's heart began hammering against his ribs as realization crashed through his denial. This wasn't fatigue or distraction. This was a medical emergency, happening right now, in the left seat, with 247 passengers depending on both pilots to keep them safe. Jake keyed the intercom to the cabin with hands that had started trembling. "We need a flight attendant in the cockpit immediately. Medical emergency." His voice cracked on the last word, betraying the panic that was threatening to overwhelm his training. Within seconds, Senior Flight Attendant Maria Santos appeared at the cockpit door, her professional smile already fading as she registered the co-pilot's expression through the security camera. Jake buzzed her through, and she stepped into the cramped flight deck to find the captain unresponsive, the co-pilot white-faced and struggling to maintain composure, and the aircraft still cruising serenely at 35,000 feet as if nothing was wrong. Maria had 16 years of experience with airlines, had dealt with drunk passengers and medical emergencies and mechanical failures, but the sight of Captain Rodriguez slumped unconscious in his seat triggered an immediate surge of fear that bypassed all her professional training. Pilots weren't supposed to be the emergency. Pilots were the ones who handled crises, who projected calm competence, who reassured everyone that everything would be fine. Seeing one of them incapacitated struck at something fundamental about the order of things. She moved quickly to Rodriguez's side, checking for breathing and pulse with the basic first aid training all flight attendants received. His skin felt clammy and cool under her fingers. His chest wasn't moving with the regular rhythm of breath. She pressed her fingers against his carotid artery and felt nothing, just the terrifying stillness of absent circulation. "No pulse," Maria said, and even she could hear the shock in her own voice. "He's not breathing." She looked at Jake, whose face had gone from white to gray. "We need to get him out of the seat and start CPR." But even as she said it, she knew the impossibility of what she was suggesting. The captain's seat was positioned in a tight space, surrounded by instruments and controls, designed for efficiency during flight operations rather than medical emergencies. There was barely room for Rodriguez's body in the seat, let alone space for someone to perform effective chest compressions. And they couldn't move him without potentially disrupting the aircraft controls, without creating more chaos in an already catastrophic situation. Jake forced himself to focus through the adrenaline screaming through his system. "I need to fly the plane," he said, his voice steadier now as training began asserting itself over panic. "I have to stay in this seat and maintain control. Can you do CPR on him there?" The question came out desperate, pleading, because Jake knew that basic flight attendant first aid training wasn't designed for this. They learned how to handle choking, how to assist with insulin reactions, how to recognize the signs of serious medical conditions and request help. They didn't learn advanced cardiac life support. They didn't learn how to run a code on someone experiencing sudden cardiac arrest. They certainly didn't learn how to do any of it in a cockpit at altitude while the aircraft continued flying. Maria squeezed into the tight space beside the captain's seat and began chest compressions, pressing hard on Rodriguez's sternum with both hands interlaced, trying to remember the rhythm she'd learned during her last recertification training. 30 compressions, then rescue breaths, then back to compressions. But the angle was wrong, the space too confined, her positioning all wrong for generating effective compressions. She could feel that she wasn't pushing deep enough, wasn't maintaining the consistent pressure needed to manually circulate blood through Rodriguez's body. Sweat broke out across her forehead as she worked, muscles burning with effort, fear making her breathing ragged and irregular. This wasn't working. She knew it wasn't working. Basic CPR in these conditions, performed by someone with minimal training, wasn't going to be enough to save a man experiencing massive cardiac arrest. "Get the AED," Jake said, reaching for the radio to notify air traffic control of their emergency while simultaneously scanning instruments to maintain their altitude and heading. His brain was splitting into multiple parallel tracks, one part flying the aircraft, another tracking their position relative to potential diversion airports, another calculating fuel and range, another desperately trying to figure out what the hell they were supposed to do about their captain dying in the left seat. He keyed the radio with a hand that was steadier than he felt. "Center, Flight 447, we have a medical emergency, one of our pilots is unresponsive, requesting immediate priority handling and vectors to the nearest suitable airport for emergency landing. The air traffic controller's response came back crisp and professional, the trained calmness of someone dealing with crisis from a safe distance. Flight 447, Roger, understand pilot medical emergency, stand by for vectors, emergency services will be notified. But Jake could hear the underlying tension even in that controlled voice. Pilot incapacitation was every controller's nightmare scenario, the situation that transformed a routine day into potential disaster. The controller began rattling off vectors and altitudes, directing them toward the nearest major airport with medical facilities capable of handling cardiac emergencies, coordinating with other aircraft to clear their path, mobilizing ground resources that would be waiting when they landed. If they landed. In the cabin, passengers in the forward rows had started noticing the unusual activity. Flight attendants moving with urgent purpose rather than their normal calm efficiency. The cockpit door standing open instead of locked. The subtle shift in the aircraft's attitude as Jake made turns toward their diversion airport. Sarah Chen, in seat 12B, looked up from her window as another flight attendant hurried past, carrying the portable AED and emergency medical kit. Something in the woman's expression, controlled panic barely masked by professional training, made Sarah's instincts flare. She'd seen that look 1,000 times in the hospital, the expression of someone dealing with a medical crisis they weren't fully equipped to handle, the face of someone who needed help but didn't know where to find it. Maria attached the AED pads to Captain Rodriguez's chest with shaking hands, following the automated voice instructions that seemed absurdly calm given the circumstances. Analyzing rhythm. Do not touch patient. The pause felt eternal, seconds stretching while the device assessed whether Rodriguez's heart had any electrical activity that could be shocked back into normal rhythm. Shock advised. Stand clear. Maria pressed the button, and Rodriguez's body convulsed slightly with the electrical current. Then nothing. No gasp of restored breath, no return of consciousness, just the same terrible stillness. The AED began another analysis cycle while Maria resumed compressions, her arms already aching from the effort of trying to pump blood through an unresponsive body in impossible conditions. The announcement came over the cabin speakers, the lead flight attendant's voice carefully controlled but unable to completely hide the underlying urgency. Ladies and gentlemen, we're experiencing a medical emergency requiring immediate diversion to the nearest airport. If there are any medical professionals on board, doctors, nurses, paramedics, please identify yourselves to a flight attendant immediately. We need your assistance. The words hung in the pressurized air of the cabin, transforming the ordinary flight into something else, something frightening. Passengers looked at each other with widening eyes, whispered conversation spreading through the rows, everyone suddenly aware that commercial air travel's veneer of routine safety had cracked open to reveal the vulnerability underneath. Sarah Chen felt the words land in her chest like a physical blow. Medical emergency, all medical professionals, immediate assistance. She knew, with the certainty of 6 years in critical care, exactly what kind of medical emergency would prompt that announcement during flight. Someone was coding. Someone was dying. Someone needed the kind of intervention that only trained medical personnel could provide, and she was sitting in seat 12B pretending to be just another passenger while someone possibly died because she wanted a week off from being responsible. The internal conflict lasted perhaps 3 seconds, the part of her that was exhausted and wanted to remain invisible warring with the part that had spent thousands of hours training to respond to exactly this situation, the part that had taken an oath to care for patients regardless of circumstances, the part of her identity that couldn't be set aside just because she was on personal time. She stood before she'd consciously decided to move, stepping into the aisle and catching the arm of a passing flight attendant. I'm a critical care nurse. Cardiac ICU. Where's the emergency? The relief that flooded the flight attendant's face answered Sarah's unspoken question about how serious the situation was. Someone was dying, and they were desperate. The flight attendant led her forward, weaving between passengers who watched with frightened curiosity, heading toward the open cockpit door where Sarah could see another flight attendant performing chest compressions in an awkward, ineffective position. Every instinct in Sarah's body went on high alert, her exhaustion evaporating as professional training took over, transforming her from tired passenger into critical care nurse in the span of seconds. She reached the cockpit entrance and took in the scene with the rapid assessment skills that had become second nature. Captain slumped in left seat, completely unresponsive. Co-pilot in right seat, flying the aircraft with visible strain, sweat darkening his uniform shirt. Flight attendant performing CPR with poor technique and positioning, clearly exhausted, clearly not trained for extended resuscitation. AED attached but not actively delivering therapy. The captain's color was gray-blue, the distinctive shade of insufficient oxygenation. His lips were cyanotic. His chest showed no spontaneous respiratory effort. This was full cardiac arrest, had probably been down for several minutes already, brain cells dying with every second that passed without effective circulation. "I'm Sarah Chen, cardiac ICU nurse," she said, her voice cutting through the controlled chaos with professional authority. "How long has he been down?" Maria looked up from her compressions, relief and desperation mingling in her expression. "Maybe 5 minutes, 6. I don't know exactly. He just stopped responding, no warning." Sarah squeezed into the cramped cockpit space, assessing the terrible geometry of trying to perform effective CPR in the captain's seat. The confined space, the awkward angle, the surrounding controls, all of it worked against effective resuscitation. But people didn't die because circumstances were difficult. They died because no one was willing to do the hard work of saving them. "Stop compressions," Sarah said, moving Maria aside so she could position herself properly. She checked Rodriguez's carotid pulse again, confirming absent circulation, then checked his airway, tilting his head back to open the passage. "I need the emergency medical kit. Does it have advanced airway equipment?" Another flight attendant rushed to retrieve the kit while Sarah began chest compressions, proper compressions, pushing hard and fast with the heel of her hand, compressing the sternum a full 2 inches with each thrust, maintaining the rhythm of 100 compressions per minute that she could perform in her sleep. She'd done this hundreds of times, had run codes in ICU beds and emergency rooms and hallways, but never in a cockpit at 35,000 feet with the ground crew hours away. Jake Morrison watched from the right seat, trying to focus on flying while acutely aware that the nurse had appeared like an answer to a prayer he hadn't known how to articulate. "What do you need from me?" he asked, his hands steady on the controls but his voice betraying his fear. Sarah didn't look up from her compressions, maintaining the precise rhythm that was manually pumping blood through Rodriguez's body. "Keep flying. Get us down as fast as safely possible. I need ground medical control on the radio. Tell them we have a male in his 50s, witnessed cardiac arrest, approximately 6 minutes down, CPR in progress, need physician consultation for medication administration." The emergency medical kit contained equipment Sarah had used countless times: a bag valve mask for assisted ventilation, oral airways, medication vials, for supplies. She continued compressions for another 30 seconds before switching to ventilation, using the bag valve mask to force oxygen into Rodriguez's lungs with precise squeezes, watching his chest rise and fall with her artificial breaths. Then back to compressions. The AED analyzed again, advised another shock. She delivered it, then immediately resumed compressions, knowing that every second without circulation increased the likelihood of permanent brain damage even if they got his heart started again. The cockpit felt impossibly small, the air thick with tension, every person acutely aware that they were fighting death in real time with limited resources and no backup. Jake established radio contact with ground medical control, a physician who specialized in aviation medicine and remote emergency consultation. Sarah could hear the doctor's voice through the cockpit speakers as she worked, giving instructions based on the information Jake relayed. "What's his rhythm showing on the AED?" the doctor asked. Sarah paused compressions long enough to let the device analyze. "Ventricular fibrillation," she reported, reading the display that showed the chaotic electrical activity of a heart that had lost all organized function. "Good," the doctor said, which sounded absurd until he explained. "That means he's shockable. VF gives us the best chance of recovery. Continue compressions, shock every 2 minutes, and I want you to establish 4 access and administer epinephrine. Sarah had started hundreds of IVs in her career, but never while simultaneously performing CPR on someone in a pilot's seat at cruising altitude. She directed one of the flight attendants to maintain compressions while she prepared the 4 supplies with practiced efficiency, selecting a large-bore catheter and identifying the best vein in Rodriguez's forearm. The turbulence was minimal, but even the slightest aircraft movement made venous access more challenging. She held Rodriguez's arm steady, palpated for the vein, inserted the catheter with one smooth motion and felt the characteristic flash of blood that confirmed placement. Secured it, connected 4 tubing, and pushed the first dose of epinephrine that might shock his cardiovascular system back into functional rhythm. AP administered, she reported, immediately resuming compressions. The protocol was burned into her muscle memory: 2 minutes of CPR, rhythm check, shock if indicated, continue compressions, repeat. She fell into the exhausting rhythm of it, her shoulders burning with effort, sweat running down her back under her civilian clothes, but her technique never wavering. This was what she trained for, what she did, who she was. Sarah Chen, critical care nurse, the person who fought death in circumstances where most people would give up. The fact that she was supposed to be on vacation, supposed to be just a passenger, seemed absurdly irrelevant. She couldn't stop being a nurse any more than she could stop breathing. It wasn't a job she did. It was her identity, woven into every fiber of her being. Jake coordinated with air traffic control, receiving priority vectors toward the nearest major airport with a cardiac catheterization lab capable of emergency intervention. They were diverting to Chicago, still 40 minutes out, 40 minutes that felt like an eternity when measured against the life of the man in the left seat. He updated the cabin crew, who made another announcement to passengers explaining the emergency diversion, asking everyone to remain seated and calm. Some passengers were crying, Sarah could hear them through the open cockpit door. Others were praying. All of them were confronted with the reality that the people flying the plane weren't invulnerable, that safety was never guaranteed, that sometimes things went catastrophically wrong despite all the training and procedures and redundant systems. After 8 minutes of aggressive resuscitation, CPR, multiple shocks, 2 doses of epinephrine, Sarah felt Rodriguez's body suddenly stiffen under her hands. She paused compressions and checked his pulse, her fingers finding the faint but unmistakable throb of spontaneous circulation returning. "I've got a pulse," she said, and heard the co-pilot's sharp intake of breath. But Rodriguez remained unconscious, his breathing shallow and irregular, his color still terrible. Return of spontaneous circulation was a victory, but it wasn't survival. They were still in the dangerous territory of post-cardiac arrest syndrome, where the body remained critically unstable and another arrest could happen at any moment. Sarah positioned herself to maintain constant monitoring, one hand on Rodriguez's pulse, watching his chest movement, ready to resume CPR the instant his heart failed again. "Talk to me," Jake said, needing to understand what was happening while maintaining his focus on flying. Sarah kept her voice calm and clinical, knowing the co-pilot needed facts not comfort. "His heart is beating on its own right now, but he's profoundly unstable. He's not conscious and probably won't be for a while, if at all. His brain was without oxygen for at least 6 minutes, possibly longer. I'm going to need to manage his airway and keep him oxygenated, and I need to be ready to start CPR again if he arrests. Ground medical, we need advanced cardiac medication standing by when we land. He's going to need immediate catheterization to identify and treat whatever caused the arrest." The physician on the ground medical channel asked questions Sarah had anticipated. What was Rodriguez's medical history? Unknown. Was he on any medications? Unknown. Any previous cardiac events? Unknown. She was working blind, treating symptoms without understanding the underlying cause, but that was emergency medicine. You stabilize first, diagnose later, and hope you made the right split-second decisions. She maintained oxygen delivery through the bag valve mask, squeezing it rhythmically to force air into Rodriguez's lungs while his own breathing remained inadequate. Her hands ached. Her back screamed from the awkward positioning. She ignored it all, because that's what you did when someone's life depended on your ability to push through exhaustion and pain. The aircraft began its descent toward Chicago, Jake coordinating with approach control while simultaneously managing the physical demands of flying without his captain, without the support system that normally made commercial aviation so safe. He was flying the approach single pilot, something he'd trained for but hoped never to do in actual emergency conditions, with the added stress of knowing that the man he'd flown with dozens of times was possibly dying 3 feet to his left despite the best efforts of the nurse who'd materialized like divine intervention. The flight attendants had secured the cabin, preparing passengers for an emergency landing that everyone hoped would be routine but nobody could guarantee. Sarah felt Rodriguez's pulse falter and disappear. "He's arresting again," she said, immediately resuming compressions, pushing hard on his chest, forcing blood through his body by sheer physical effort. The AED delivered another shock. She gave another dose of epinephrine. 2 more minutes of CPR. His heart restarted, flickered, stopped again. She kept going, kept fighting, refusing to let him slip away, because that's what critical care nurses did. They stood between patients and death and refused to yield ground. The descent continued. Chicago grew closer. Sarah worked with mechanical precision, every action practiced thousands of times, every decision guided by protocols that had been refined through decades of emergency medicine research and experience. "We're 10 minutes out," Jake reported, his voice tight with concentration. "Emergency crews are standing by on the runway. Is he going to make it?" Sarah didn't answer immediately, focused on the rhythm of compressions, the check for pulse, the administration of another medication. When she finally spoke, her voice was honest rather than reassuring. "I don't know. We're doing everything possible, but cardiac arrest in flight has poor outcomes even with immediate advanced care. His best chance is getting him to a catheterization lab in the next few minutes and hoping they can identify and fix whatever broke." It wasn't the answer Jake wanted, but it was the truth, and he respected her enough to give him truth instead of false hope. Rodriguez's heart found rhythm again, maintaining spontaneous circulation for longer this time, his body perhaps finally responding to the aggressive intervention. Sarah allowed herself a moment of cautious optimism, maintaining her monitoring position but not actively compressing, giving his cardiovascular system a chance to stabilize on its own. His color was marginally better, the cyanotic blue fading to a less alarming gray. His breathing remained inadequate, requiring continued assisted ventilation, but his pulse was steady, his blood pressure probably marginally adequate to perfuse his brain and vital organs. They were winning, maybe, or at least not losing as badly as they had been. The aircraft descended through 10,000 feet, the Chicago skyline visible through the cockpit windows, emergency vehicles already visible on the ground with lights flashing. Jake configured the aircraft for landing with smooth, practiced movements, calling out altitudes and speeds, managing the approach with the kind of precision that came from thousands of hours of training and experience. The flight attendants made final preparations, ensuring passengers were secured, emergency exits were accessible, the cabin ready for whatever came next. Sarah remained focused on Rodriguez, one hand on his pulse, counting heartbeats, calculating oxygenation, ready to restart CPR the instant his condition deteriorated. She'd brought him back from death multiple times in the past 30 minutes. She'd keep bringing him back as many times as necessary until they reached help on the ground. The landing was smooth despite the emergency circumstances, Jake demonstrating the skill that had earned him his position as first officer with a major airline. The aircraft rolled out on the runway and stopped, and within seconds emergency medical crews were swarming the aircraft, paramedics and flight physicians rushing into the cockpit with equipment Sarah recognized from countless hospital codes. She gave them a rapid-fire report, presenting condition, time down, interventions performed, current status, medications administered. They took over Rodriguez's care with practiced efficiency, moving him from the cockpit to a stretcher to an ambulance while Sarah stepped back, suddenly aware that her role was complete, that she was just a passenger again, just Sarah Chen who'd been sitting in seat 12B trying to be invisible. Jake caught her arm before she could retreat into the cabin. His face was drawn and exhausted, but his eyes held profound gratitude. "You saved his life," he said simply. "I don't know what would have happened if you hadn't been here, but I know we'd have lost him." "Thank you." Sarah felt the words settle into her chest, heavy and meaningful, reminding her why she became a nurse in the first place, not for gratitude or recognition, but for these moments where training and expertise and willingness to act made the difference between someone living and dying. She'd responded because she couldn't not respond, because her identity as a healthcare professional transcended whether she was working or on vacation, because saving lives wasn't something she did only when she was being paid for it. Passengers filed off the aircraft slowly, many of them pausing to thank Sarah as they passed, having learned somehow that the woman in seat 12B had run to the cockpit and performed emergency procedures that saved the captain's life. She accepted their thanks with quiet acknowledgement, uncomfortable with the attention, more focused on wondering whether Rodriguez would survive the next few hours of treatment. Return of spontaneous circulation in the field didn't guarantee survival to discharge. He'd been without oxygen for several minutes. His brain might have sustained irreversible damage. The cardiac event that had precipitated the arrest still needed to be identified and treated. He was alive now, but alive and recovered were very different outcomes. The incident report would take hours, statements from Sarah and Jake and the flight attendants, detailed documentation of everything that had happened from the moment Rodriguez slumped unconscious until emergency crews took over his care. Sarah walked through it all in a kind of fog, her body finally acknowledging the exhaustion she'd been pushing past, her hands trembling slightly with post-adrenaline reaction. She'd performed under pressure countless times, but never quite like this, never with limited resources, never without the full support system of a hospital code team, never while the patient was literally flying an aircraft that hundreds of people depended on. She'd improvised and adapted and pushed her skills to their limits, and somehow it had been enough. 3 days later, Sarah received a message through the airline. Captain Michael Rodriguez had survived. The catheterization lab had found a complete blockage in his left anterior descending artery, the widowmaker lesion that caused sudden cardiac arrest in otherwise healthy middle-aged men. They'd stent it open, restored blood flow, and Rodriguez had regained consciousness with no apparent neurological deficits. He was weak and facing months of cardiac rehabilitation, but he was alive, talking, aware that a nurse in seat 12B had performed the kind of aggressive emergency intervention that had given him a fighting chance. He wanted to thank her personally when he was released from the hospital, wanted to acknowledge the debt he owed to someone who'd had no obligation to intervene but had done so anyway. Sarah read the message sitting in her sister's apartment in Denver, the vacation she'd been trying to take now resumed after 3 days of incident reports and FAA interviews. She felt the familiar mix of emotions that came with successful resuscitation, relief and satisfaction and a kind of humble gratitude that she'd been in the right place with the right skills at exactly the right moment. She hadn't saved Rodriguez's life because she was looking for recognition or reward. She'd done it because when a flight attendant announced a medical emergency and asked for help, she couldn't stay sitting in seat 12B pretending to be someone other than who she was. Being a nurse wasn't a job she could clock out of. It was woven into her identity so deeply that separating her professional self from her personal self was impossible. She thought about that afternoon at 35,000 feet, about the moment she'd stood up and identified herself, about the decision to run toward crisis rather than remaining safely invisible. She'd been exhausted, burned out, desperate for a break from the relentless demands of critical care nursing. But when someone needed what she could provide, the knowledge, the skills, the willingness to fight death with every tool available, she hadn't hesitated. That realization was simultaneously comforting and frightening. It meant she could never really escape the burden of being capable, of possessing expertise that others might desperately need. It meant she would always be Sarah Chen, critical care nurse, whether she was working a shift or sitting in seat 12B trying to rest. But perhaps that burden was also a gift. Perhaps being the person others turn to in crisis, being someone whose training and experience could make the difference between life and death, was worth the weight of constant responsibility. Rodriguez was alive because she'd been on that flight. His children would have a father. His wife would have a husband. His future would exist instead of ending in a cockpit at 35,000 feet. That outcome had required everything she'd learned in 6 years of intensive care training, every hour of practice, every code she'd run, every time she'd pushed through exhaustion to focus on saving one more life. It had required her to be exactly who she was, not despite being on vacation, but because her identity as a healthcare professional transcended circumstances and context and convenience. The airline offered to compensate her for the emergency medical care she'd provided. She declined, uncomfortable with the idea of being paid for responding to a crisis. This hadn't been a job. It had been an obligation that came with her training, a calling that she'd answered because doing otherwise would have violated something fundamental about who she was. The airline insisted on covering her flight and hotel expenses, on ensuring she received formal recognition for her actions, on making certain that Captain Rodriguez could thank her properly when he recovered. Sarah accepted gracefully, understanding that sometimes people needed to express gratitude even when you hadn't acted expecting any reward. She returned to work 2 weeks later, walking into the cardiac ICU with the same sense of coming home that always accompanied her return to the hospital. Her colleagues had heard about the incident. News traveled fast in medical communities, especially dramatic stories about nurses performing emergency interventions in impossible circumstances. They asked questions, wanted details, marveled at the challenge of running a code in a cockpit. Sarah answered briefly, deflecting attention, more interested in catching up on her patients and returning to the routine of hospital nursing. But something had shifted during those minutes at 35,000 feet. She understood more clearly now that her identity as a nurse wasn't confined to hospital walls, wasn't activated only when she was wearing scrubs and carrying a badge. She was a healthcare professional always, in every context, whether she wanted to be or not. That identity came with obligations and burdens, with the constant awareness that she possessed knowledge and skills that others might desperately need, with the responsibility to respond when crisis emerged regardless of whether it was convenient or comfortable. It was exhausting and sometimes overwhelming, but it was also who she was at the most fundamental level. She couldn't separate Sarah Chin the person from Sarah Chin the critical care nurse any more than she could separate her body from her shadow. They were the same, integrated and inseparable, and she'd stopped trying to escape that reality. Captain Rodriguez sent her a letter when he was released from the hospital, 4 pages of careful handwriting expressing gratitude that felt almost overwhelming in its sincerity. He described waking up in the cardiac ICU, confused and disoriented, gradually understanding that he'd experienced sudden cardiac arrest and survived only because a critical care nurse had happened to be sitting in seat 12B. He described learning about the emergency procedures Sarah had performed, the multiple times she'd brought him back from cardiac arrest, the aggressive intervention that had kept him alive long enough to reach definitive care. He described his gratitude not just for surviving, but for surviving with his mind intact, his memory preserved, his ability to recognize his family and understand his situation uncompromised by the minutes his brain had been without oxygen. "You had no obligation to help me," he wrote. "You were on vacation, trying to rest, entitled to remain in your seat and let someone else handle the emergency. But you didn't. You ran toward the crisis instead of away from it, and that choice saved my life. I will spend the rest of my days grateful that you were on my flight, grateful for your training and expertise and willingness to act, grateful that healthcare professionals like you exist in the world. Thank you." Sarah read the letter multiple times, feeling the weight of his words, understanding that she'd been part of something significant, something that would ripple through Rodriguez's life and the lives of everyone who loved him. She'd made a choice in a moment of crisis, responding to need with the tools she possessed, and that choice had created a future that wouldn't have existed otherwise. It was humbling and empowering simultaneously, a reminder of why she'd chosen this profession despite its demands and difficulties. Sometimes you got to save someone. Sometimes your training and experience and willingness to push through exhaustion made the difference between someone living and dying. Those moments made everything else worthwhile. She kept the letter in her locker at the hospital, taking it out occasionally when shifts were brutal and patients were crashing and she questioned whether she had anything left to give. Rodriguez's words reminded her that she was doing important work, that her expertise mattered, that showing up and being competent and refusing to give up on people created outcomes that rippled outward in ways she might never fully understand. She'd saved one life that afternoon in the cockpit, but that single life connected to countless others, family members who wouldn't experience the devastating loss of someone they loved, colleagues who would continue working with Rodriguez, passengers who would benefit from his experience on future flights, the entire network of human connection that would have been severed if he'd died at 54 from sudden cardiac arrest. Months later, Sarah flew again, settling into a seat with the same hope for peaceful travel she'd had on that afternoon before everything changed. She didn't expect drama or crisis or emergency calls for medical professionals. She hoped for the ordinary boring flight that characterized safe modern aviation. But she also understood now that if something happened, if someone started seizing, if a passenger went into respiratory distress, if another emergency emerged, she would respond. Not because she wanted to, not because she was looking for recognition, but because she was Sarah Chen, critical care nurse, and that identity transcended whether she was working or resting or trying to be invisible in seat 12B. It was who she was, permanently and completely, and she'd stopped trying to be anyone else. The hospital had asked her to present the case at their monthly morbidity and mortality conference, sharing the lessons learned from providing critical care in such an unusual environment. Sarah stood before her colleagues, physicians, nurses, respiratory therapists, all the professionals who comprised the cardiac intensive care team, and walked them through those harrowing minutes in the cockpit. She described the challenges of performing CPR in a confined space with poor positioning, the difficulty of establishing access during flight, the psychological pressure of working alone without the support system they all took for granted in the hospital. Her colleagues listened with rapt attention, asking questions about protocols and decision-making, marveling at her ability to improvise and adapt standard procedures to impossible circumstances. The biggest challenge wasn't the medical complexity, Sarah told them during the question period. I've run codes more complicated than that one. The biggest challenge was accepting that I was the only resource available, that there was no code team coming, no attending physician to provide oversight, no pharmacist to double-check medications, no respiratory therapist to manage the airway. It was just me, a basic emergency kit, and my training. I had to trust myself completely, had to make decisions without second-guessing, because hesitation could have cost Captain Rodriguez his life. The room was silent as her words sank in, everyone understanding that she'd faced a nightmare scenario, complete professional isolation during a life-threatening emergency, and had performed flawlessly despite it. Dr. Martinez, the cardiac intensive care attending who had mentored Sarah through her first years in the unit, spoke up from the back of the room. What you demonstrated, Sarah, is the difference between technical competence and true clinical expertise. Anyone can follow protocols in optimal conditions with full support. But adapting those protocols to extreme circumstances, maintaining clinical judgment under impossible pressure, refusing to give up despite limited resources, that's what defines an exceptional clinician. You should be very proud of what you accomplished. The room erupted in applause, Sarah's colleagues recognizing the remarkable nature of her actions, understanding the skill and composure required to save someone's life at 35,000 feet with no backup and no margin for error. The story had reached beyond the hospital walls, covered by local news outlets fascinated by the dramatic narrative of a nurse on vacation running to save an unconscious pilot. Sarah had reluctantly agreed to a single television interview, uncomfortable with the spotlight but recognizing that sharing her story might encourage other healthcare professionals to respond when emergencies emerged during their personal time. The interviewer had asked her why she'd acted, why she hadn't remained in her seat, and Sarah had struggled to articulate something that felt so fundamental to her identity. I'm a nurse, she'd finally said. That's not something I am only during my shifts. It's who I am all the time. When someone needs help and I have the ability to provide it, I can't choose not to act. It would be like choosing not to breathe. It's just what I do, who I am. The airline industry had taken notice of the incident as well, using it as a case study for training flight attendants to work effectively with medical professionals during in-flight emergencies. Sarah had been invited to speak at aviation medicine conferences, to share her perspective on what airlines could do to better support passengers with medical expertise who might need to provide emergency care. She'd made recommendations about improving emergency medical kits, about creating clearer protocols for granting cockpit access during medical emergencies, about the importance of having ground medical control available to provide real-time consultation. Her experience had become data, contributing to the ongoing evolution of aviation safety procedures. But beyond all the recognition and presentations and case studies, what stayed with Sarah most profoundly was the simple human connection she'd forged with Captain Rodriguez. They met for coffee 6 months after the incident, after he'd completed cardiac rehabilitation and been cleared to return to flying. He looked healthy and fit, though Sarah's trained. I noticed the subtle signs of someone who'd survived a major cardiac event, the careful way he moved, the medication reminder on his phone, the awareness in his eyes that his mortality was no longer abstract. They talked for hours, Rodriguez describing his gradual recovery and his determination to return to the cockpit, Sarah sharing her own processing of the event and what it had taught her about her profession and herself. "I think about you every time I fly," Rodriguez told her as they prepared to part ways. "Every pre-flight check, every routine procedure, I remember that day and how quickly everything can change. I remember that my life continued because someone with your training happened to be in seat 12B and chose to act. You gave me a second chance, Sarah. I'm going to make it count." Sarah felt tears prick her eyes, understanding that this was why she became a nurse, why she endured the exhaustion and the emotional toll and the constant weight of responsibility. For these moments where her actions created futures that wouldn't have existed otherwise, where her willingness to carry the burden of expertise made a difference that rippled outward in ways she might never fully comprehend.